Designed to empower you to better health through knowledge and education. I'm your host, Dr. Richard Huntoon from Advanced Alternative Medicine Center. We are located at 138 Canal Street in Pooler Park, that is in Pooler, Georgia. We're in Suite 404 of Building 400. If you want to stop into the office, that's always welcomed. I would love the opportunity to meet you, have an opportunity to ask some questions, answer your questions, and then you probably get a brief evaluation out of my own curiosity for wanting to understand how to help you. I'm sure I can help you. I know I can help you. You just have to show up. So if you want help, that would be a great way to do it. Short of stopping into the office, the next best way to get a hold of me would be to call my cell phone directly at area code 845-561-2225. Again, 845-561-2225. That is my cell phone. It's my personal cell phone. Please do not text that phone, as that phone is not equipped to receive texts. I will never get your text. I will never respond to your text, and then that would defeat the purpose of you reaching out to me. But you can email me directly at docrick, DOCRICK, at spineboy.com. Again, docrick at spineboy.com. And whether you stop in, call, or email me, it's my pleasure to help you to better understanding with the concerns that you have related to your health. Having a health problem is not okay, and it kind of dovetails nicely with what we're going to talk about today. If you have a health problem and you've had it longer than you would like it, then it's time to let it go. And so this particular health class is specifically on letting go, and if you're having trouble letting go, and that relates to the health and function of your large intestine. The large intestine is the other half of the metal element that we've been covering the last couple of months. The first half is the lungs. So we have the lungs and the large intestine, but there's another facet of it that actually transcends all of it, which happens to be your skin. So if you have lung issues or skin issues or large intestine issues, that facilitates with the metal element, and we're covering the second half of the metal element, which is the large intestine. Let's see, what can I tell you about the large intestine or the metal element? The metal element is animal instinct, the primary energy of our reactions to life. That of the large intestine is the instinctive reaction. Animals react based on instinct. It's part of the large intestine motion. Compare with the lung primary emotion, which happens to be that of surrender. So you have instinctive reaction. Sometimes it's, got to get out of dodge. That's your reaction, instinctively, get out of danger. Other times, if the lungs are more dominant, then you're going to surrender to the situation. What else can I tell you? The muscles associated with the large intestine happen to be the hamstrings at the back of your thighs. So if you get tightness or restriction or tight hamstrings, being able to bend over, touch your toes, that kind of thing. Hamstrings, that's usually a large intestine issue. Your tensor fascia lata, which is a triangular muscle on the side of your hips, whose the tendon for that muscle goes all the way down to the side of your knees. So the lateral aspects of your thighs, where we stuff a lot of emotion, those are your tensor fascia latas. There's people who get TFL syndrome. That's related to the large intestine. And then last but not least, we have a square type muscle. It's called the quadratus lumborum. It's sitting in your lower back right next to your spine. Attaches your lower rib, your 12th rib, to the pelvis itself. That's the quadratus lumborum. What else can I tell you about the large intestine? There is something very, very important. The beginning part of your large intestine is known as your ileocecal valve. This is probably the most abused part of the body. Some say the second most abused. It kind of goes back and forth between the gallbladder and the ileocecal valve. The ileocecal valve is the junction between the small and the large intestine, and when it gets abused, one of two things happen. Either things fail to move through your digestive system properly, ultimately giving you constipation. It will create lower pressure in your lower right belly. It will create low back pain. Um, so putting a cool pack over your lower right belly for about 20-25 minutes and pushing lots of water will typically help to resolve the ileocecal valve, one of the most common syndromes that we experience in our country. And ultimately, the ileocecal valve is controlled by the organ that gets removed over 1 million times a year in this country, known as your gallbladder. So your gallbladder helps to regulate how the ileocecal valve functions, and when the gallbladder is not happy, the ileocecal valve begins to malfunction. But if you want to help to reset it, that cool pack on your lower right belly for about 20-25 minutes and push a lot of water will help to reset that ileocecal valve. Emotions related to the large intestine. Things like being dogmatically positioned or rigid in your way of thinking, your inability to let go. Large intestine, you need to be able to let go, otherwise you get constipated. So somebody who's dogmatic or rigid in their way of thinking typically doesn't let go. We have crying. We have compelled to neatness. Things have to be a certain way or things have to be clean in order for a person to relax. And defensiveness. People who are overly defensive typically have large intestine emotions and large intestine problems. And one of the major reasons for why we have these issues has to do with the intake, the prescribed intake, or the intake of antibiotics that we get through our food. Due to the livestock that has been treated with antibiotics, we get the secondary effects of that, which disrupts the balance within your large intestine related to the good bacteria, the yeast, and the candidia. And when you have that kind of imbalance going on and you have an excess amount of yeast and candidia, the fermentable foods, the sugars, the carbohydrates that people have a tendency to eat too much of is going to cause the yeast and the candidia to produce excess amounts of gas. When you get excess amounts of gas in the upper part of your digestive system, you get gas and bloating in the belly. You get potentially hiatal hernias and those sorts of things. The person may become moody and depressed as a result of all of this. When you get lower bowel gas and your belly just seems to get really, really big and bloated, that's typically due to a lack of good quality probiotics, and you're eating too many refined and processed carbohydrates. So at that point, we'd want to recommend a supplement made by our chief supplement company called Standard Process, a supplement called Zymex, Z-Y-M-E-X. Taken 2 per meal 3 times a day typically will help to restore balance. You need to counterbalance that with taking a good high quality probiotic, which we get from a company called Metagenics. So that will certainly help that imbalance to be restored. Likewise, if you have this imbalance and you consume too much or any of things like cheese, dairy, vinegar, alcohol, especially beer, other fermentable products, you can expect to begin to produce excess amounts of gas and or mucus. And this will begin to clog your upper respiratory system, creating things like asthma, bronchitis, upper respiratory infections, or it can clog your skin, leading to things like psoriasis, eczema, dandruff, or even things like rosacea as a result of eating these ingredients while you have this imbalance or dysbiosis within your large intestine secondary to antibiotic ingestion. Other thing that's important, a relationship associated with, we talked about the gallbladder's relationship with regulating how things get into the large intestine. How things pass through the large intestine is a function of the relationship with the large intestine and the kidneys. The kidneys regulate fluid balance. So when your body needs to hold on to more fluid, it's going to extract it from your large intestine, which is ultimately going to lead to constipation. How do you know if you're constipated? Well, we did a class on what's your transit time. I think that was last week. What's your transit time gives you an idea how fast things pass through you or how slow things pass through you. And if you're constipated, things are going through too slowly, and that leads to excess amounts of toxins being absorbed into the system, overwhelms the liver, leads to muscle, joint, and tendon issues like arthritis and those kinds of things. So we want to make sure that your body's not dehydrated. Well, how much water should I take in, Dr. Rick? Well, you should take in 1 quart of water for every 50 pounds you weigh every single day. And when you drink the requisite amount of water, your body will start to adapt to the fact that it has more water than it's had in the past, so things will start to function more efficiently, your metabolism will speed up, your ability to process your food will improve, and certainly that would be a good thing. So how long does it take food to go through you? Well, we talked about what's your transit time. It should take roughly between 20 and 24 hours. If it takes less time than that, you have absorption issues. If it takes more time than that, you typically have gallbladder, kidney dehydration issues. So having an evaluation would be important. So what you should consider, if you suffer with any imbalance of your large intestine, things like colitis, diverticulitis, irritable bowel syndrome, Crohn's disease, chronic constipation, back and forth between constipation and diarrhea, you should consider coming into the office and taking advantage of this month's offer to you, which would be to come in, have an evaluation. We'll evaluate your large intestine and understand if it's functioning properly or not. We'll probably ask you to do that test at home with the 3 boiled red beets in a salad to see how fast things get pushed through you. If you've ever taken antibiotics and you didn't take the requisite 6 months plus of taking a probiotic along with the Zymex to help get rid of the excess yeast, you may be having issues, quote, letting go. So if mucus is a problem for your body, upper respiratory symptoms, asthma, pneumonia, psoriasis, eczema, dandruff, rosacea, these are all reasons associated with a large bowel imbalance where the body's producing too much mucus, leading to the issues that you have. I would love to help you with all of those issues. So if you're watching this video and anything that I've touched on seems to speak to you, please take the time to call me at area code 845-561-2225. Again, 845-561-2225. Do not text that phone, but you can email me directly at docrick, DOCRICK, at spineboy.com. Or stop into the office at 138 Canal Street, Suite 404 of Building 400. That is in Pooler, Georgia. Happy to meet you, happy to talk to you, happy to email with you. But if you're having health issues, this is the time of year to help clean up that large intestine before we get too far into winter and things shut down for the dead of winter, and then you're going to have to wait a whole year in order to clean these things up. So appreciate you watching. Tune back in next week, same health time, same health station. This is Dr. Richard Huntoon from Advanced Alternative Medicine Center saying, I look forward to supporting you when your health matters.